Hello and welcome. My name's Dr. Jewell and I'm one of the anaesthetic consultants at the Royal Cornwall Hospital and St Michael's Hospital. And today I wanted to talk to you about doing your hand or arm surgery under what we would call a regional block. That is, you put your arm to sleep but not the rest of you. Now there are considerable advantages to this, and this is what we're going to go through to help reassure you that this is the correct decision for you. So why not knock me out, doc? Well, that's often the question we're asked. In fact, general anaesthetics are extremely safe, but they don't always make you feel great afterwards. You may feel a bit sick or nauseous, groggy, memory loss and tiredness are quite common, and shivering and chills are also common. The chance of you getting a sore throat is about 40%. The chance of having your teeth damaged is rare at 1 in 2,000, but important. General anaesthetics are not good for your heart and lungs. If you have other health issues, the risks become greater. So why numb my arm? Well, it's safer, it's better for you, there are less of the side effects, and some of them you don't get at all. And in fact, the pain relief is much better as well. You have time to start other pain relief as the block starts to wear off over a period of time. There's a quicker recovery and therefore ready for your cup of tea and to go home, giving you a shorter hospital stay. You will also hear from your surgeon after the operation. You're far more likely to remember this if you've had a regional anaesthetic than if you've had a general anaesthetic. A key point to remember is that this process is not unpleasant. You can have some relaxing medication that will make you feel good. You may sleep or doze during the operation. You can bring some music to listen to if you'd like. You can chat to the staff. A lot of patients find it pleasant or an enjoyable experience, and the vast majority say they would have it done this way again, which I think speaks volumes. So let's talk actually about the process that you're going to go through. So this is done with some local anaesthetic. You're given some relaxing medicine first if you'd like it, and then an injection with some numbing local anaesthetic is put in. This will go either at the top of your arm or around your collarbone. An ultrasound machine is used to help ensure that the local anaesthetic is positioned correctly around the nerves, which ensures that your arm is made appropriately numb. The injection may cause a bit of tingling and may ache slightly. The operation will only start once your arm has been tested as being fully numb. So you can watch what I'm doing if you like. I'll explain to you what I'm doing as I go along.
I watched Holby last night, so...
Oh, well, it's not quite as dramatic as that, hopefully, but you never know. Good, so I'm just going to put a little bit of local in here, a little scratch, sorry, a little bit of stinging. Well done. Right. Okay, if you put it on 0.5 would be great. 0.6, something like that.
0.6, yeah.
Well done.
Zoom in on the screen.
Okay. Tiny little scratch and a little bit of stinging, sorry. Right, now the other thing to look for is to make sure you're not in the territory of the vein, which is just to the right there. You see how big that is and then I press slightly on it and it disappears. I just need to be careful of that, because I think just below that is probably that might be the median nerve. So let's have a look. So go in here. So this block worked very quickly, but you will be sent to recovery for the block to cook, and this may take up to 30 minutes. So, can you spread your fingers out for me? Spread them out wide. Can you squeeze my fingers? Yes, we've still got a little there. Good. Can you extend your wrist? Can you move your wrist backwards? Okay, so we've got pretty good radial territory. Spread your fingers. Pretty good arm there. But we've still got a little bit of grip. Squeeze my fingers. Okay, so we'll give that a little bit more time. Brilliant. Once the local anaesthetic has been put in, you may go to recovery for a period of time. This is amusingly a process called allowing the block to cook. Once you are ready and the theatre is ready, you'll be taken into theatre to meet everybody and to have your operation. So during the operation, you'll be lying on the operating trolley. A lovely warm blanket will be put on you so you feel warm. You feel nice and relaxed because of the drugs that will be given. You can listen to your own music, or you can bring a book to read if you'd like, although you'll have to hold it with one arm. You will not see the operation at all, as there will be a sterile drape between you and the surgeon in order to keep things clean. The surgeon will explain to you what he's done after the operation, and this is a considerable advantage, so you will know the results of your operation straight away. So for those of you who want a sneaky peek, here it is. Those of you who don't like the football results, look away now. As you can see, our patient is perfectly comfortable while the operation is proceeding as planned. The operations usually take between half an hour and an hour. After the operation is finished, you'll have a sling for your arm and you'll get off the operating table and into a wheelchair where you'll be wheeled back to the day case unit. After the operation's finished, you'll be given some instructions for your pain relief when the numbness wears off. It's likely to be between 4 to 6 hours, but maybe sooner or a little bit longer. It's really important to take your painkillers as soon as it starts to feel uncomfortable to get on top of the pain early. Do remember, your arm may be numb for a while after your operation, and during this time it's vulnerable, so please take special care of it. There is a pamphlet produced by the Royal Cornwall Hospital called Regional Anaesthesia for Hands, which has a lot of information for patients having hand surgery. It may answer some of the questions and put in print some of the things that you have learned by watching this film.
Hi, I'm Rob Poulter. I'm one of the hand surgeons. I think we offer a very good block service here. I think it gives my patients a lot of advantages in terms of good anaesthesia, good post-op pain relief, and it enables people to be awake for their whole procedure, so I can explain to them both during the operation and after the operation what's gone on and what they can expect from their recovery.